When we discuss heart disease, predominantly people are discussing heart attack. And why does person get a heart attack? Is most of the times people get heart attack due to blockages in heart arteries or the blood vessels supplying the heart, and they are called coronary arteries. So as a result of the blockage development in coronary arteries, patient will develop heart attack. So what are these blockages? Basically, blockage means deposition of fatty material or cheesy material in the lining of coronary artery. So the blood vessels are lined up by a tissue called endothelium, which is just a thin lining. And under this lining, there's a deposition of cholesterol or fatty material. And this deposition, as we all age, gradually it increases, and that causes blockages. So this is what is all about blockages. There are two types of risk factors. One we call is a modifiable risk factors, and second is non-modifiable risk factors. So what are non-modifiable risk factors? So non-modifiable risk factors are like your age. We all are going to age, so you cannot change your age. Your sex, you're a man or woman. These are, if you're a man, you're more likely to have heart disease. If you're a woman, you're less likely to have heart disease. Then your ethnicity. So if you're a black or white or Asian. So if you're an Asian population, then you're South Asian especially. Other factors are modifiable risk factors like your diabetes, your blood pressure, your cholesterol level, your exercise capacity or stamina, your daily activity, your smoking or non-smoking, and your alcohol intake. So these are the modifiable risk factors. So we'll go one by one. So diabetes again is genetic as well as lifestyle disease. So your diabetes you can keep under control, and that's how your risk factor will be controlled. So if you control your sugar, your risk of developing heart disease goes down. Second factor is high blood pressure. So again, it's modifiable. If you treat your high blood pressure, control it with medication and lifestyle, or only with lifestyle, depending upon your blood pressure, your risk of developing heart disease or blockage goes down. Third factor I mentioned is cholesterol. Again, cholesterol can be genetic as well as because of dietary intake. So if you control your diet, take regular exercise, and as required, take a tablet as prescribed by the doctor, then your risk of heart disease will go down. Fourth factor, smoking. We all together say that smoking should never be done because it is a killer and it is going to develop blockages for sure. So smoking should never be done. Then comes alcohol. Alcohol should be taken in minimal quantities or in moderation, they say. So that's up to 14 units of alcohol in a week is fine. That will not put you at high risk of blockages. But if you take high amount of alcohol, it can increase the risk of not only heart failure, but also risk of blockage development will also go up because of various reasons, not only per se alcohol. So these are the various risk factors I have discussed. Another important factor is lifestyle, the way you manage your lifestyle. If you are active, doing good exercise, then you're fine. But if you are sedentary life is as bad as smoking. So you should be very active and doing activity throughout your day, basically. So these are the risk factors for development of blockages. Symptoms of heart blockages, we can divide them into two classes. One is urgent symptoms or emergency symptoms. So many patients will present with heart attack directly, and they will not get any symptoms of heart blockage as such. So direct presentation with heart attack will get symptoms like pain in the chest, at rest, sweating, uneasiness, tightness in the chest, breathing difficulty, etc. So these are the symptoms of heart attack. And if the blockage develops gradually and patient does not get a heart attack, patient is going to develop symptoms of angina. Angina is a layman's term, and in angina, what it means is patient develops breathlessness on walking a certain distance or climbing flights of stairs. Patient will complain of breathing difficulty. So, or their stamina goes down. So that's a sign of angina. Another symptom or sign of angina is patient develops tightness in the chest after exertion. So they develop, for example, they climb 2 flights of stairs and they feel tight in the chest, or they feel very breathless and they have to stop. And once they stop, they start feeling better. Again, that is a symptom of angina. Sometimes people get palpitation, they feel that heart is fluttering. Again, that could be a sign of heart disease as well. Diagnosis of heart disease is done, number one, by clinical judgment. So when the patient comes to cardiologist like me, I will ask him a detailed clinical history. And that based on the detailed clinical history, we will analyze whether the patient is suffering from angina or has symptoms which are typical of heart disease or atypical. That means they are not very classic of heart disease, but we cannot exclude heart disease. We will do their risk profiling using risk factors, as we already discussed. We'll do their basic clinical examination. So these are the basic things any cardiologist will do first. Then we will take them for further investigations. Investigations will include investigations like ECG, baseline ECG. Then we'll do 2D echo, color Doppler examination to assess the heart structure and function. And then the third test we will do is a stress test, treadmill stress test. So all these three tests are simple and they can be easily done on outpatient basis. Patient does not need to get admitted for these tests. So these are the basic tests. Then we can move on to next level of tests, which is basically coronary angiography or stress thallium or CT coronary angiography. The treatment depends on how bad the disease is. So obviously when a patient comes to a cardiologist like me, what we will do is do the routine assessment of the patient, which is basically a standard protocol. And after doing all these tests, we'll find out how much percentage of blockage is there and where these blockages are and what the patient is like. So when these blockages are minor, when we say minor means, let's say less than 60%, okay? So less than 60% blockage is there, we will go and treat them with medication only, okay? So only medication and lifestyle changes, controlling the risk factors, and they don't need to go ahead with angioplasty or bypass operation. Now the problem comes when the blockages are more than 70% and in the critical areas of the heart vessels. Okay, so when they're located in the main branches of the heart vessels, they're more than 70%, they're causing angina, positive stress test, then these patients may need angioplasty, which is stent implantation. And if there are multiple blockages in multiple territories and it's a complicated disease with high burden of blockages, then in such circumstances, we may refer the patient for coronary artery bypass operation or open heart surgery. So depending upon the situation, patient will be advised further treatment. Whether you get angioplasty or bypass, the medication will always be there. Your lifestyle management has to be there. So these two things are the backbone of the treatment. Lifestyle changes and controlling of your risk factors and medication for cholesterol and blood thinners. If you follow a healthy lifestyle, okay, then you are likely to reduce the chance of development of heart disease, or you're likely to prevent the heart disease. So you should avoid all the risk factors basically. So you should not smoke. You should take care that you don't develop diabetes or high blood pressure and all the cholesterol. So you have a healthy diet, good sleep, all the do good things to your life. Your chance of getting a heart disease will go down. One factor very important is genetic factor, which probably I did not mention earlier. So if your mother or father has a heart disease, we say when the father has a heart disease, when he's less than 55 years of age, or mother has a heart disease when she's less than 65 years of age, then your chance of developing heart disease are going to be higher. So that is one factor, again, is non-modifiable risk factor, genetic factor, and you can't do much about that. But saying that, even if you have this risk factor in the family, what you can do is you can follow good lifestyle and you can do all the good things which I mentioned, and then that can reduce the chance of heart disease.